We have just started a couple minutes ago doing this procedure to help with a keloid that's been significantly improved already with surgery and radiation, but there's some residual left about 6 months post-op. What you're seeing here with this cryoprobe going in is a obliteration of the residual keloid. We put the probe in under anesthesia, the patient is comfortable, and slowly what you're seeing is the crystallization of the probe that's passed through it, and the goal here is ongoing crystallization of the keloid itself until the keloid necroses or dies and does not recur. In 1 or 2 sessions, typically one, what often occurs is the patient has significant satisfaction rate, about 97%. In this African American patient, which is good, is that this helps really not only effectively improve the situation with keloid, virtually eliminate it, along with hypertrophic scars, but it really protects the melanocytes or the outer skin surface much more than surface treatments. So I really think this is a breakthrough and a game changer in terms of keloid therapy. And we'll see this in a few minutes as this continues to improve and eliminate this keloid. What you're seeing now in the second snippet is the merger of the distal, this portion of the probe and the freezing that's over here. That's the first thing that occurs with the freezing of the keloid. You'll see that these will continue to merge and will continue to follow the progress of this keloid treatment. What you're seeing now is the merger of that white frost going across, and this will continue to infiltrate the keloid and go around it, and our goal ultimately is to get onto about 1 to 3 millimeters onto the normal skin, and that should truly help with this keloid in a non-invasive fashion and really virtually eliminate the need for surgery and radiation exposure. I don't know if we're entirely in focus on this, but I think it's still worth seeing here. I've moved back a little bit because this video camera doesn't have a macro lens, but if you take a look, you can start to see that the central portion here is starting to widen, and that's what we're desiring here. So remember, what you're seeing initially was the width here and then the joining of the two, and then it's starting to spread this way. And we want this to go far enough that it's as wide as what this outer portion is, but even farther by a couple millimeters for the effect that we're trying to achieve. I'm going to slide up over here and show you this instrumentation here. You can see the canister going down, aiming at about 30 to 45 degree angulation, which is what's preferred for the infiltration of the liquid nitrogen. And I really think this is a breakthrough therapy in treatment of keloids. You can see it's starting to grow in the middle, which is exactly what we're trying to achieve. I think we're moving along very well. One question you probably want to know is, how new is this technology? Is this something only been tried out for a few months and it hit the market? What's interesting is this product has been around since the early 2000s, so a decade or so, started in Israel, and just come to America in the last year or so. So I think a lot of people across the world will truly be interested in how revolutionary this product is in terms of helping people that suffer from keloids, and also even milder versions called hypertrophic scars. Seen some incredible clinical examples of results with that as well. The probe has been disconnected now, and so we're just watching the thawing before we actually withdraw the needle. And that ends this little video on therapy using this cryotechnology for keloids.